Hi, everybody that's joining us now. Welcome to the latest Dermalux Academy education webinar. And today's webinar will be helping us in recognising and treating the topic of the month, which is acne, and how we can manage those symptoms with Dermalux LED as well. My name is Melissa Williams and I head up the Dermalux Academy. So I will be guiding you through today's session. And the session will last for about 45 minutes to an hour. And hopefully we'll have time at the end then to answer any questions that you may have. So please do use as a question and answer box at the bottom there. So drop those in. I probably won't see them as we're going through the webinar, but I will definitely revert back to them at the end of the session. This session is recorded, so because you have registered for today's session, you will also be able to review it again, and it will also be great if you want to share that with your team members as well. So let me present you with the agenda for today's session. So we're going to take a look at the skin physiology and exactly what's going on in the skin when we talk about the topic of acne and how that is affecting our skin at the deeper layers. We're then going to look at the acne pathology and causes of acne. We'll take a look at some of the NHS grading so that we can better understand, the right ways to treat different types of acne with LED phototherapy. We'll then look at how we manage the management strategies, but also any pre-treatment considerations, any acne protocols with Dermalux. So we're going to take a look at mild to moderate acne, and then how we change that up if we've got moderate to severe acne. We're going to then look at any post-treatment considerations, take a look at some combination treatments, and then obviously at the end, we will have some time to answer any questions as well. So I wanted to start firstly just by sharing with you a couple of stats. Firstly, we have seen a 200% rise in adults seeking acne specialists since 2015, which is a huge jump. And 95% of people aged 11 to 30 are affected by acne to some extent. 10% of the global population suffers with acne, which is a huge number. And most of us have had acne on and off for several years before the symptoms then start to improve. And about 3% of adults globally have acne over the age of 35. So we can see this is a very common skin condition. So let's understand it a little bit more. So acne, clinically known as acne vulgaris, is a very common, that we've just seen, chronic inflammatory skin disease, and it's affecting the skin normally on our face, the upper parts of our body, and our back as well. And we know that acne develops as a blockage to that hair follicle here in the epidermis, where we've got dry dead skin cells and sebum buildup. And then this blockage causes that blockage of sebum that is continuing to produce with enlarged sebaceous glands at this point. And remember, sebaceous glands, we know, are such an important structure and function for our skin. They provide 90% of its surface lipids. However, excess sebum production due to the enlargement of the sebaceous activity means that there's a lot of serum buildup, but nowhere for it to go. So when we've got that blockage, we've just nothing that we can do. And then on top of that, you throw in the fabulous hormone, androgen hormones like testosterone, when it's that time of the month or during puberty. And this then causes the sebaceous glands to become even bigger and produce even more sebum. And also when this hormone comes to play, we have lower levels of linoleic acid. And with these lower levels, remember, linoleic acid is that fatty acid that helps support the ceramide function, the ceramide formation, in our skin, which is crucial for the skin's barrier. So with lower levels, when this hormone comes to play, actually results in weakening of the skin's barrier, in an increased transepidermal water loss. So as a result of this chain reaction now, we find these changes in our skin, which cause hyperkeratinization, slower desquamation, and further sebum production again. So on top of this blockage, you've got this excess sebum. When hormones are present, the anagen hormone is present, we then see more of that, which puts the pressure on even more. And so now what happens is in comes C. acne bacteria. C. acne bacteria, that acne causing bacteria that we have in our skin anyway. It's in all of us, but some of us have different strains of it, which is why we can experience acne at different levels. But when it gets into the mix of all of this excess sebum that is now building up in that blockage, it is the perfect place for bacteria to multiply and thrive. And it's this that then causes the inflammatory process, which creates pus. And pus is there, it's formed to be able to get rid of that bacteria, to destroy that bacteria. And then you are left with this spot. Okay. So let's look at this next slide, which will kind of show you a little bit more what I'm talking about. So here is the comedone, okay? You can see that you've got the blockage here at the top of the epidermis, at the top of the hair follicle. You've got this sebaceous gland here, this hormone-sensitive sebaceous gland, which is enlarged, which is now going to be producing all of this sebum. And then you've got two kinds of comedones. You've got a closed comedone. Your closed comedone is normally known as your whitehead. You've got a layer of skin just over the surface of that comedone. But you can see here that this is where you've got all of those dry dead skins that are kind of starting to build together and create that blockage. And then you've got an open comedone. An open comedone is where you don't have that layer of skin on the surface. This is where you see those blackheads in the skin. Because now what we can see is that the black part of it is where that sebum and excess dry dead skin cells have started to oxidize, which turns it black. So these are open comedones, which allow that to happen, that process. And then you move on to, this action here where you can now see that there's inflammation. It's slightly raised on the surface. You've got all of that, the blue parts, which is representing that bacteria thriving nicely now and multiplying by the second. You can see that there is excess sebum. And we are now seeing that the hair follicle wall starting to break, which we absolutely don't want to happen, because then this is what happens. And we're in a lot of trouble when we get to this stage. The skin is very inflamed, excess bacteria, excess sebum production, and now that follicle wall has broken, and you are most likely to have a scar from this kind of situation. So we want to stop it from getting to this point. A couple of other causes then. So we've spoken about the testosterone and the anagen hormones, and that hormone plays a huge role in our bodies. It's about stimulating the growth and development of the genital area as we're getting older in boys, but then for women, for maintaining muscle, bone and strength for girls as well. And the sebaceous glands are particularly sensitive to this type of hormone. And it is thought that with this increased level that we see around that time of the month or during puberty, that we are producing much more sebum than the skin actually needs. So that's one major cause. Another thing then is genetics. Acne can run in families. If your parents had acne, it is likely that you will also develop it. One study has found that if both of your parents had acne, you are more likely to get more severe acne at an early age. And it's also found that if one or both of your parents had adult acne, you are more likely to get adult acne too. Acne in women, then again, we talk about the hormones. Women are more likely to have adult acne than men, and it's thought that there's many causes of adult acne, which does tend to be the changes in hormones. So around that time of the month, some women have flare-ups of acne just before their period, because mid-cycle our estrogen levels lower. We don't want this to happen. This is all the good stuff. It's going to help stimulate the collagen and keeping our skin strong and doing what it needs to do. So that starts to drop down, and the estrogen levels lowers, but then the androgen levels, rise. And we now know how the androgen levels are affecting our skin. Pregnancy, again, many women have those symptoms of acne, usually during the first 3 months of their pregnancy. Polycystic ovaries are a really common condition where there's small cysts inside the ovaries, but 10% of women suffer with it, and that again is down to an increased circulation of the androgen hormone. Other triggers, such as skin trauma, normally with using products, we know that a lot of people that have acne tend to use strong soaps, scrubs, excessive exfoliation, because they just want to keep the skin clean. They think that's the right way to do it, and then what you end up doing is causing more inflammation, more trauma, and your skin is then in this vicious cycle because the overproduction of sebum comes in play because you've just removed it all and now it wants to produce more. So you just can't get that balance with it. Certain medications, such as steroid medicines, have known to contribute acne in older people, and diets. So we know that normally with a high glycemic index, that type of diet, which is an inflammatory diet, can cause breakouts on the skin, but very, very poor evidence in chocolate, let me tell you. Chocolate's still fine. Stress, no sleep, poor nutrition. If we have no sleep because we feel stressed, then no sleep slows down the repair and the regenerative process. So it means that spots will last longer and be more likely to scar. So there are a couple of things that are causing the main factors that can cause acne in somebody. And let's take a look at some of the NHS grading there with acne. So you've got grade 1, which is known as mild acne, and this is mostly whiteheads, little whiteheads across the skin, not normally bumps. You can just see a couple across the face, maybe the odd papule or pustule, but these are normally closed, non-inflammatory, and no bumps on the skin. You've then got grade 2, which is your moderate to severe, your mild to moderate acne. And normally you'll see here multiple papules and pustules, mostly over the face. You can see some open comedones now, so you're going to see more blackheads where the sebum is oxidized. As I said, more papules and more pustules at this point. Then we look at grade 3 now, which is your moderate to severe acne. Now this is where you'll normally see numerous papules and pustules, mostly inflamed. Now you're going to get a couple of inflamed ones over the skin. They are going to be raised. You're going to feel the bumps on the surface, and you may start to see quite a lot now on the chest area as well with grade 3 acne. And then finally, grade 4 acne. These are deep-seated, much larger, painful and inflamed papules and pustules. And you're going to see this really over the face, chest, and possibly over the back area as well. Unfortunately, this type of acne will scar, and it will lead to post-inflammatory hyperpigmentation as well. So we've understood a little bit about acne. Now let's just remind ourselves, what is LED phototherapy? Because what I want to then do is show you how LED phototherapy is a crucial tool in the treatment of acne. And as a reminder, with Dermalux, we have devices that have FDA clearance and medical certification for the treatment of acne. And so we're going to talk about, what that is and how we can manage that shortly. But just for anybody that wants a reminder of what is LED phototherapy, I like this slide. It gives you kind of a one-liner, and it gives us a one-liner as well, so that we can talk it through to clients. So LED phototherapy is the application of low-level light energy, and energy is the key word here. Low-level light energy through bioactive wavelengths to stimulate, regulate, or inhibit specific processes in our skin. Okay, so it's there to either stimulate underperforming, regulate overperforming, or to, to inhibit activity that just shouldn't be going on in our skin. So essentially, LED phototherapy delivers energy to enhance cellular performance and accelerate repair mechanisms. Now, energy is the key word that I mentioned here, and light is another form of energy. There's lots of different types of forms of energy. Remember, energy is needed to impact other things in its environment. It creates changes within our skin, or within pretty much everything that is absorbed by light. It creates that change, but on our skin in particularly, we can see those visible changes. We have cells within our body that have evolved over the years, and more new things are coming to light now, and they are cells that are known as photoreceptor targets, chromophores. And these are cells that are there designed to absorb wavelengths, to absorb light energy, to be able to function at the optimal level. And so the really impressive thing about light energy is it is the most precise and the most targeted form of energy. That is a scientific fact. There is nothing that is as targeted for our skin as light energy. For example, we can travel to certain levels of the skin, within certain levels of a cell, even within the certain levels of the organelle within the cell, to create that chemical change. And when we're talking about acne, we can, in a session, we can destroy bacteria, accelerate to accelerate the wound healing process to prevent scarring, and it's anti-inflammatory. We can do that whole process within that same treatment, whether you're using a low power device or you're using a high power device. There's different chemical change depending on the power or the delivery of joules of energy into the skin. But for example, if you take something like antibiotics, which is a form of energy that creates changes within our skin, there is a low to medium chance that we get that result in the time that we want it, without with many side effects. With antibiotics. But with light therapy, there's none of that. It's so precise and targeted, and that's why I just love working alongside this amazing product. So let's remind ourselves of the wavelengths that a Dermalux device uses. So we use the most clinically proven, industry-leading wavelengths that are backed by science, and they offer the highest clinical benefits relative to all other nanometers. So do not take our word. Do your own research. There are thousands and thousands of clinical papers out there that you can access with your fingertips, but you can also, we have a lot of these on our marketing portal as well, so you'll be able to access them much quicker. But these nanometers are so important because it means that we are reaching the target point of our cell. And as you know, with the Dermalux device, we have the ultra precise delivery to that target point of the cell, with plus or minus 2 nanometers, versus other LED devices that can be plus or minus 10 nanometers, which in photonics, that is huge, because it could be the point that you miss that target altogether. Okay, so we have our 3 wavelengths: blue at 415 nanometers, red at 633 nanometers, and near infrared at 830 nanometers. And blue is our antibacterial wavelength. I'm going to talk in a moment exactly how blue is working on the skin to destroy that stubborn bacteria. It's great for all grades of acne. It has anti-inflammatory effects as well, and can even target certain viruses within the skin. Great for a cold sore, if anyone ever suffers with those. And we know that the added benefit with blue is it's proven to enhance mood, which we also know is a side effect of acne. It can have much more damaging effect to self-esteem and low mood, and it can even lead to depression. 9% of acne sufferers have said that they have been clinically diagnosed with depression because of this condition. It just goes beyond, skin when we're looking at acne. So blue light. Then we take a look at red light. Red is measured at 633 nanometers, our rejuvenation light. And again, we're going to talk about why red light is important at certain stages of acne. We're going to come on to that shortly. We know that blue, it travels to the epidermis, and the red at 633 nanometers travels down into the dermis. And then finally, we have possibly the most fantastic tool anybody can have in their business when treating light therapy, which is near infrared. I love talking about this wavelength. I think every single protocol should have this, minus a couple. We all suffer with inflammation, whether we see it or not. We all eat the wrong thing. We all feel stressed. We all, don't sleep well. All of these different things. And by normalizing that skin's activity and removing and modulating inflammation, we know that our skin will be able to respond so much better. So it's the most important. And don't forget, near infrared is completely invisible. So if you have a device at home and you think it's not working, that's why it's completely invisible to the naked eye. But this is our healing wavelength. Calms redness and irritation, modulates the inflammation, accelerates the healing, and also promotes pain relief as well. So we're going to take a look at each of these wavelengths now in a bit more detail and how they work when we're talking about acne. And the first one, of course, we're going to talk about is our blue light. Blue at 415 nanometers, which we know is traveling into the epidermis. Remember, in the epidermis is where we've now got this blockage in the hair follicle, and we have got this wonderful environment for C. acne bacteria, the photoreceptor target in our skin at this point, and this is the perfect place for it to multiply, which then leads to the inflammatory process and so on. So blue light, we know, reaches the porphyrins. It is absorbed by the porphyrins, the bacteria. Now, without blue light, your bacteria has a resting energy, just enough energy to do what it's got to do or to multiply at a steady rate. When we shine blue light at 415 nanometers onto the skin, the bacteria itself is the photoreceptor target, and it's the bacteria that then absorbs this light, this energy. And now the bacteria becomes a higher energy molecule. Now, because of this action, most people are like, why on earth would you want to do that? Well, this now triggers a chemical change in our skin that produces ROS, reactive oxygen species. And it's a response in our skin which results in cell death of unwanted cells. So therefore, it leads to the destruction of bacteria. The particular ROS is called singlet oxygen. And therefore, it leads to that destruction of the bacteria without causing damage to any other skin cell. The focus is with the bacteria only, so we can safely destroy that bacteria there and then. And if we've already started to destroy the bacteria that's then causing the inflammatory process, we're going to start to notice that difference on our skin quickly. And I don't know if any of you that are using the devices or treating acne at the moment, if you've got the odd spot coming up and you have a treatment with blue light, it's almost guaranteed, it definitely is in my house, that the next day that spot does not come to light, because we are sorting out the problem deeper within the skin before it has that chance to come up to the surface and before we have it cause any scarring. So then let's take a look at near infrared now. Near infrared measured at 130 nanometers. The inflammatory aspect of this condition makes it a prime candidate for the use of near infrared. And, this can be used regardless of the severity of the condition, and I'd recommend you use it for all acne clients. And it helps to reduce that inflammation. It does not pose any risk to causing any more problems with acne, and inflammation itself is the risk We want to reduce that to allow the skin to normalize its activity and take it out of panic mode. And by taking it out of panic mode, we're going to prevent scarring. We're going to allow the skin to heal more effectively and much quicker as well. Inside the mitochondria, which we know the mitochondria is the powerhouse of the cell. This is the part of it's the organelle within the cell that generates energy for all of the other cells. It produces ATP, adenosine triphosphate. And ATP, remember, is the token. This is the way I like to remember it. It's the token in an arcade machine. It's a token that you take to the arcade machine, you put it in, and the arcade machine fires up. So we need the mitochondria to be producing lots of these tokens for all the different aspects that we need within our skin. But there is a process through the mitochondria called the electron transport chain. It's like a 5-part process, like a production line, if you will. And if there is a blockage within the mitochondria, within that production line, then there's no ATP being produced. And without the ATP, our cells do not function, which leads to a whole range of skin conditions, and where in most cases acne just continues to become worse. That out of the 5 stages, you've got a 4th stage, which is called the cytochrome C oxidase, CCO. And this part of the chain can sometimes become blocked. And if you've got a block here, because what happens is you've got water that then is absorbed, oxygen that is absorbed through the cytochrome C oxidase, converted into water, and the end result is that production of ATP. But molecules can block the oxygen from passing through. And when we have that blockage, what we have noticed is that there has been an inflammatory mediator activity seen. And so therefore, we have got inflammation right down in the mitochondria, which is then causing other areas of inflammation. Starting right there with that tiny, tiny organelle. There's hundreds of organelles within one skin cell of the mitochondria. So what happens is near-infrared is brilliant at unblocking that blockage of the cytochrome C oxidase. Normally it's nitric oxide that gets stuck there, and near-infrared can flash nitric oxide out the way. So if we can modulate inflammation, take the skin out of panic mode, we can allow the skin to respond to this better, and it can also be able to accelerate that wound healing process and prevent the scarring that we see with acne as well. And then finally, red light. So we know that red at 633 nanometers is capable of increasing the cellular activity at the powerhouse of the cell in the mitochondria. This is the photoreceptor target that absorbs red light at 633 nanometers to accelerate the production of ATP. So when you're using near infrared and red together, you're just, you're unblocking and you're accelerating that activity to get a much quicker result. So when we've got that cell energy being produced, it's brilliant. But acne-prone cell turnover isn't efficient, and the natural, desquamation process is a bit up and down. Okay. So we know that red can increase activity, and we know that red can stimulate our cell renewal and speed up our cell renewal by up to 200%, which is exactly what we want with grade, mild to moderate acne. However, in severe acne, we want to avoid this wavelength until we've normalized the activity with near infrared and help modulate inflammation, because what we want to do is we want to avoid accelerating any further problems within the skin. So let's normalize it first. And normally when we're looking at cystic acne, grade 3 and 4 acne, we want to normalize the skin first, help with the process of the inflammation, and then we can start to introduce red kind of when we start to see that improvement on the skin, when we're going back into grade 2 and 1 acne, to then stimulate that cell renewal. Okay, we don't want to stimulate the the deeper inflammation within our skin. So you can see that red, near infrared and blue are crucial at the different stages that we have in terms of acne, and is why we get incredible results in a short space of time. And the great thing about a Dermalux device is that you can treat multiple indications in one treatment, because you can pick and choose, tailor make your protocol for your client. In some of our devices, we do have our preset settings already in there. But there's also another option if you really wanted to tailor make this for every individual that you see. So let's move on then to pre-treatment with LED, what your clients may be taking, and then we'll take a look at the protocol example so that you've got an idea of how you can then start to implement this with clients in clinic. So a couple of things then, if your client has been prescribed any of these, so prescription medication, tretinoin, roaccutane, certain antibiotics, certain hormone drugs as well, then we know that some of this medication does have exceptionally high concentrations of vitamin A. And while we know they're very effective, they do have high levels of vitamin A, and there is a risk of retinoid dermatitis. And when patients are in this risk group, it is important to avoid light therapy. The great thing is that you only need to avoid it. Once your client has finished that medication, they can then start having light therapy 5 days after they have stopped that medication. But what we don't want to do is we don't want to increase the cell activity while cells are in the middle of a dermatitis reaction, because it could worsen it. In some cases, though, we know that tretinoin, clients are on that for a long time. They may have been on it for years, and we know that actually the skin can become stronger, and as it becomes stronger, then the tolerance level is different. So sometimes we do suggest again, it's down to you. You could do a patch test on your clients if they've been on it for some time, but to avoid any photosensitive reactions on the skin, phototoxic or photoallergic reactions, we suggest normally waiting 5 days until they've stopped that medication. Many clients may have been prescribed topical drugs such as benzoyl peroxide. So we know that this can dry the skin, it can irritate the skin and cause that crusting and sometimes even swelling, but it could also lead to a phototoxic reaction. So we suggest avoiding this immediately before treatment. Okay. However, clients can be using it, in the day. If they apply it in the morning, that's absolutely fine, or in the evening, sorry. So these might be a couple of additional things that your clients are doing. But what you can do is you can encourage your clients, before they come into their for their first treatment, for example, you can help to, settle that excess oil production with topical products. And great ingredients that do that are B3, zinc, squalene oil, which just helps to settle that excess oil leading up to your first LED treatment. Because if you do have really thick levels of it on the skin, we know that sometimes it depends. This is more kind of severe, excessive oily skin. It does affect the absorption of light. So again, really helping them to get a much better result is to recommend these kind of ingredients in products beforehand. Example protocols then with LED. So let's take a look at what we suggest for a mild to moderate acne. So this is kind of grade 1 to 2 acne clients. We normally would suggest then the first 4 weeks, your clients would have 2 treatments per week. Now, if you are using the Tri-Wave MD, there is a minimum of 1 a week. Ideally, we would say 2 a week. We see much quicker results in a much shorter space of time, but you will still get there even if you are doing 1 treatment a week. But also, if you've got the compact light, a lower power LED, then you could just increase that treatment time 2 to 3 sessions a week. If you're using a Flex MD, ideally you could rent this out to your clients so that they're using it every single day. or again, that is something that they can then use themselves at home as well. But if you're using it in treatment, you want to be doing a minimum of 3 treatments a week. And you do that for the first 4 weeks. And in the final 3 weeks of that program, you can then suggest 1 treatment per week. But in all cases, you keep the power on high, the highest that device allows you to, and you will be using blue at 415 nanometers, near infrared at 830 nanometers, and then red at 633 nanometers. So you will be using all wavelengths. Now, in some of the devices, you already have this set up in your preset settings. Okay. Now, let's take a look at then moderate to severe acne. Now, we're looking here at, your 3 weeks. Now, sorry, I have seen that there is a bit of a typo in here, so do forgive me with that, but I'll mention it now for you. So I wouldn't take a photo of this slide if that's what you're doing, maybe just to make a note. So the first 3 weeks, we want to have as many treatments as we possibly can, and that is using blue and near infrared. We want to destroy the bacteria as quickly as we can, and then we want to start working with the inflammatory process and that wound healing aspect of our skin. So the first 3 weeks, again, I would say, I think if your clients can come in with 3 treatments a week, then they're going to get a much quicker result in a shorter space of time. What I would say here is that to keep the power on medium and to avoid red. So please forgive me, red is not included in that protocol. So blue and near infrared, and then you use that on medium power. After those 3 weeks, when you started to notice that improvement in the skin, they've now had 9 treatments, you can really notice the reduction in that angry inflammation on the surface of the skin. You started to see the spots and the pustules and the papules start to clear up. Then you can start to introduce your red back into the protocol, and then you can increase the power there as well, and you can reduce the treatment time. So again, we would go back to 2 a week, because once we've done those first 3 weeks, we should now be moving into that mild to moderate acne, which then we can now start to perform that, which is including red. So yes, please forgive me on that. Red here should not be included. So it would just be blue and near infrared on a medium power. So you're looking at 9 treatments, and then you can start to introduce red again. Strategies for post-treatment then. So once they've had light therapy, you'd have a course of that, and I always recommend that when you're talking about Dermalux light therapy, you don't need to just put light therapy. You can really now open up your treatment menu and use all of the things that you now can treat, and acne clinic being one of those. So really highlight that as a non-invasive, no touch procedure and treatment. But then once your client has got to their results and they've had their course of, depending on, which device you have, depends on how many treatments they'll have in that course. But once you've had that course of treatments in close succession of each other, you can then stop that and you can then go on to monthly settings. We normally would recommend the tri-wave therapy setting at this stage, because it's a bit of everything. It's for non-medical rejuvenation and non-medical bacterial function. So it just helps to keep the skin ticking over, helping the skin to maintain those results. Always wear SPF. That's the same for all skin condition. It's no different for acne. It's really important that they find the ones that don't feel thick and feel lighter on their skin. And there's some really great SPFs out there with some of the brands I'm sure you're all using. Combination treatments. So we're going to come on to a couple of treatments that work really well with light therapy in the treatment of acne. Skincare we can take a look at shortly as well. I've got a slide to share with you some information on that, and also sufficient water intake. We forget how powerful water is in helping keep our skin doing what it needs to do, keeping it hydrated, helping us to remove the toxins from our skin as well, and allowing everything to work so much better. So a couple of combination multimodality treatments then. Of course, there's numerous peels out there that are brilliant at sterilizing the skin. And so with light therapy, you can use that immediately after a peel. What we would say though is that if you've got a self-neutralizing peel, that you would then do that probably 24 hours later. So do that the next day. Then IPL, again, you can use light therapy immediately after IPL. Again, you just need it for 10-minute protocol to be able, normally blue for bacteria and near infrared to help with the healing process of the skin. Medical needling is normally used when, we've managed to target the acne, but now we're left with that acne scarring. And where light therapy is brilliant for new scars, if you've got clients with much older scarring, I definitely think that medical needling is a great approach, as well as certain peels and fractional treatments. However, we can use light therapy then as a treatment alongside that. And then, of course, with micro, hydrodermabrasion, many treatments out there as well that are helping to clear the skin and prep the skin. We can then use light therapy as an add-on. So some really great treatments that you can use with light therapy. So clinically effective skincare, really important. I've been in the industry for 21 years and the entire career has all been about skincare. Skincare, I think, is just important, a part of the treatment of acne. And normally improvements are often delayed if we, and can get worse if we're not using the right products. But we can see as well that, there may be times where we get additional spots, purging of the skin with certain products, but then it starts to get better. So you may start to see that with certain skincare products, but it is a really important part. And a couple of things here to mention: gentle cleansing. That has got to be one of the big tips that I would give to clients. They automatically think that they want something that's going to strip their skin, but causing that irritation is going to really slow down the skin healing and could then lead to further complications as well. So really gentle cleansers are the way forward. Avoid aggressive scrubbing for the reasons that I mentioned. We don't want to aggravate that cycle, which then creates more sebum where the skin's trying to overcompensate. Vitamin A, I'm a big believer in active vitamins within skincare. It's what our bodies are made up of, and recognize it well. And vitamin A, we know, is great for regulating keratin production and rebalancing sebum production as well. Vitamin C, depending how vitamin C is delivered into the skin, is really important. Some vitamin C products could lead to acne becoming worse, but if you've got particular types of vitamin C that are absorbed in different ways, then vitamin C is crucial for reducing inflammation. Vitamin B5 again helps to accelerate the healing aspect of our skin, but also again works on reducing inflammation. Certain types of retinols. Now with retinol, we can continue to use light therapy. It's absolutely fine. Your client can use these products, during in a treatment. What we suggest is you don't apply it directly to the skin immediately before light exposure, because it could have a phototoxic reaction, but it's absolutely fine to be using in the skincare regime. Salicylic acid, benzyl peroxide, again, these are a couple of things that we've mentioned. Modulating glucosides. Now, these are concentrated emulsions that target the skin's sensitivity or discomfort and helps to reduce inflammation. And the number one key thing here is to avoid picking. We all do it, and we all know we shouldn't do it, but we know from those pictures that I showed you before that if we break that follicle wall, we are going to scar on our skin, and we're going to make the problems a whole lot worse before they get better. And I just wanted to share with you then, before we finish and we go on to any questions that have come through, there are lots of key studies, clinical trials, hundreds of them, and you can access them on the internet. We've also got loads of information on the marketing portal, where you'll be able to read about the white papers and LED and go into the advanced results, the pathology and how that has impacted the skin using light therapy and the different wavelengths that we've mentioned. Thank you so much, everybody. Have a brilliant evening, and I look forward to seeing you all again at some point. Take care. Thank you.